Question number 4, Dr. Jian. Order.
Mr. Speaker,
Dr. Jian.
My question is to the Minister of Health. Has he received the latest OECD report on public health spending trends over the past decade? And how does New Zealand compare with other 27 countries surveyed?
The Honourable Tony Ryle.
Mr. Speaker, I've seen the latest OECD report that shows from 2008 to 2009, before the impact of the world economic crisis, the OECD real average growth in health spending was nearly 5% and New Zealand's was 6%. With the financial crisis hitting the world in the 2009-10 year, the average increase in health spending for the OECD countries fell to 0, with many, including Norway, Ireland, Greece and Denmark, actually cutting their public health spending. Despite the tight times, this government has been determined to protect and grow our public health service, and as a result, in the 2009-10 year, the latest year for which comparative data is available, I'm pleased to advise that in total contrast to this dramatic reduction in average OECD spending, New Zealand had a 3.4% increase in real health spending, the third highest of the 27 countries.
Dr. Jian.
Supplementary. What does the OECD say about improved services New Zealand patients have got from the increased funding, even though the funding increases are lower than during the boom times?
The Honourable Tony Ryle.
Mr. Speaker, across the OECD, reductions in health spending have often translated in reductions in services for patients. Yes. And despite the tough economic times and the slowing of the rate of increase in health spending, according to the latest OECD data, New Zealand has had one of the largest increases in the numbers of patients being cared for or getting operations in our public hospitals. This stands in contrast to the previous government that doubled the health budget, and in real terms, fewer people got operations.
Question number 5, Grant Robertson.
Thank you, Mr. Speaker.